You're watching ABC4 News.
Some frontline healthcare workers received their second dose of the COVID-19 vaccine this week, but many are still waiting for their first. ABC4 senior health correspondent Saray Chin has more on who comes next.
Frontline workers are getting vaccinated with COVID-19 vaccines, and the plans are now underway for the rest of the state and the country. We have Dr. Todd Vento, an Intermountain Healthcare infectious diseases physician, to walk us through. But the main question is, everybody wants to know, when can everyone, the general public, get vaccinated?
Yeah, it's really one of those thoughts of this process, which has been announced by the Centers for Disease Control based on the recommendations of the Advisory Council for Immunization Practices, and then it goes out to the states. And as most folks have probably heard, we're started with frontline healthcare workers. We've just started our second dose this week after receiving our first dose about 3 weeks ago, as well as having done long-term care facility residents and staff. And with the next phase in the state of Utah to include some on the essential workers who are not necessarily frontline healthcare workers, but also teachers in schools, with the inclusion of potentially adding 75 years and older. So as that progresses, then you'll start to get into other individuals who are a little bit younger, who might have some underlying illnesses, and then eventually proceed to the general population. In terms of when that'll happen, estimates for the country are really now looking about mid-spring. So probably sometime in April. But again, it'll all depend on how many vaccines are used up, how many more are distributed and made, and there's a lot of headway on that too, because both Moderna and Pfizer, for example, have indicated that they'll make even more vaccines than originally planned for. So I would say spring is the target for the general population, but it could come earlier, depending on how the early phases go.
Dr. Vento, what's the process? Why do we need this vaccine? Why is it so important?
Yeah, so this vaccine, in particular, the first two that have come out under this emergency use authorization by the FDA are the Pfizer and Moderna, and they have a unique mechanism, which is this mRNA technology, which is kind of the first time we've actually seen this in vaccines. But they had both done the studies as well as produced the vaccine at the same time, which is very unusual for vaccine. Usually you do the studies and then look at your data. If it looks great, then you start producing it, and that takes a long time. Well, they took a financial chance and said, for Operation Warp Speed in the government, to say, let's go ahead and produce it, and if the studies come out good, then we're ready to go. That's why it happened in a much shorter time than before. The reason why it's important is because they showed a 95% efficacy after the second dose, about a week after the second dose, where the differences in those who had gotten placebo versus vaccine was 95% protection from getting COVID. And so that's early data, but it was very important data, and it's certainly one of the higher ones we've seen with vaccines. So that is a tool to help stop transmission in our community. And in Utah right now, we're 33% positive test rate. So that plus the other measures that we know work, mask, social distancing, not gathering, combined.
One last question. Did you get the vaccine? How safe is it? Just a few seconds.
Yeah, sure. I got the vaccine 3 weeks ago. My first dose. I got my second dose about 2 hours ago. First dose, I had arm pain. Second dose, we'll see what happens. And my colleagues are indicating possibly a little bit of low-grade fever, fatigue, and we'll see what happens there. But I'm happy to have gotten it so that I can feel even more protected.
Dr. Vento, thank you for everything that you've done and you're doing. We anxiously await for the vaccine. And for more information, log on to intermountainhealthcare.org. Thanks again.
Okay, thank you.